up and take action together and be leaders.
And if I may say something, I definitely agree with that because it's already hard enough to get individuals mass now.
Mm-hmm.
In my head, it's like, why is it so difficult? You should want to protect yourself, let alone others.
Right.
So just like Miss Ashley said, like it is like a little. Are we really going to follow those policies? And we have to work together.
That's exactly right.
Mm-hmm.
I think that's the part that kind of worries me is everybody jumping on board so we can try to get this thing under control. And a lot of people who are against wearing masks and saying this their right. I do understand it's their right, but at the same time, you know, when are you going to have compassion for the next person? And until everybody gets on the same accord, we're still going to have these problems. And so I'm hoping and praying that this new administration is able to encourage Americans as a whole to buy into, okay, this is what we need to do as Americans. And like they said, it has to cross party lines. It can't be, well, I'm this and I'm not going to do it because I'm this. Everybody has to get on board in order for us to be able to get past this thing. Everybody has to be in the same mindset.
Yes, sir. And my next question is for anyone. Anyone can answer this question. What are your feelings about individuals not wearing a mask or refusing to wear a mask?
It's disheartening, and that's the only emotion that I have for that. Talking with some of my friends, I know we have discussions as far as like how they feel about the mask. And I'm one of those ones where if I hear you say that you haven't been social distancing and you're not wearing a mask, there's no reason for us to be in contact with each other because it shows me that, besides you caring about yourself, you're putting others at risk.
Yeah,
Any
absolutely. I'm right there with you, Mia. I'm disheartened and I'm angry when I hear people say that too. And one of the examples, kind of the images that I use is, people say that wearing a mask or not wearing a mask is their right and their freedom, but this is the government trying to protect us in the same way that it's not your freedom to choose not to wear a seatbelt or not. You're required to wear a seatbelt in the car because that's going to protect you. You're you have the freedom to partake in alcohol, but you don't have the freedom to get behind the wheel if you've consumed alcohol because the government's trying to protect you and others. This is the same way. We're setting up that law, we're setting up that policy. So you have to wear a mask so you can protect yourself and protect others. The same way we have seatbelts, the same way we have other laws in place. So it's disheartening and it's angering for sure.
Call it
Angela,
oh, go ahead.
I'm
Well, I'm
sorry.
sorry. I was just going to say, it really, it kind of angers me, and I try to be a little more understanding. I know there have been times where I've gotten out of my car and got maybe 10 feet away from it and realized I didn't have my mask. But then I turn around and go get it. And I think everybody can be guilty of that. But when I see people go all the way into a store with no mask on or in crowds and they don't have their mask on, I feel that they are being, if I may say, a little selfish, and that kind of infuriates me. But I don't say anything. I just make sure because I can't control what other people do, and people get offended if you say something about them not wearing a mask. So what I do, I just make sure I have mine on, and I make sure that the people that I'm with have theirs on, and that's pretty much as I can do. But it frustrates me and angers me when I see that.
Anyone else?
Yeah, I think as well, and I'm piggyback on Brother Ward. Um, the selfishness is what gets me about it because I think a lot of people who are in that position of this whole anti-mask thing, um, unfortunately, have a belief that as long as it doesn't affect me, then it must not be real, or it must be something that is generated in some type of conspiracy theory type of way. The minute I knew somebody who had it, I realized how important it was, because a friend of mine got COVID back in March when it first started, and he survived luckily. But the thing was, at that point, I was like, "Oh, it's dead serious. Stop playing. Just take it seriously. Stop playing." Because I wasn't as serious, but I wasn't as flaunting about the store says you can't come in. Like I saw a guy at the Royal Farm store the other day. You can't come in unless you have a mask on. Sir, you don't have a mask on. He's pissed. He's walking out. Why can't y'all just have me pay for my gas and that's it? Sir, the sign says. Just obey the sign. Don't do anything that's going to get you in trouble, because I have seen some of these people get unfortunately arrested by it, and I applaud them for calling the police and getting them involved, because I think now we're talking about not just somebody giving you a cold, or not just somebody passing on a treatable disease. We're talking about something that we just found out has a treatment in the last 9 months, where almost 300,000 people have died. 3,000 people died yesterday. That's more than the people that died at 9/11 on that one day. And we relish that day so much, yet the insensitivity of it, we haven't even thought about it along that magnitude, that's happened at least 3 times last week. 3,000 people died. That's 3 days of 9/11. 3,000 people died. But we put so much attention on that one event. And I'm not taking away from that event, but I'm saying we should be as serious about it, seeing how quickly this could take somebody out. And I just don't believe how people are not taking the whole mask game seriously. But like Brother Boy said, I got mine. You don't want to wear yours? That's fine. That's fine. Because when you're in the hospital, you're going to hope that doctor has his mask on, so he can then operate on you, or he can perform whatever medical process or procedure he needs to perform on you. We trusted masks all these years for those medical professionals, but then all of a sudden, that's a health issue. That's one lady said she was handicapped because she had a disability, rather, because she couldn't wear a mask. Come on, I'm not buying that. Not buying it. I'm moving on. Just wear mine, protect mine. Tell my kids, don't listen to that mess. Put your mask on. Move on. That's it.
My son takes it very seriously. He doesn't, he's homeschooling right now. But when we do go out in the public, he makes sure that he has his mask on him at all times, and he's wearing it too. In fact, he gets in the car with it on. He is not playing around with it. And I love him for that. Anyone else?
I just wanted to comment. They want to open the schools back up, and I can say this, at my particular school, my school system, I'm in Maryland, and we still schooling virtually. We've had so many buildings that closed, including my building, which I opted not to go in the building, and I'm glad that I didn't. We had someone to test positive. So those who were in and out of the building, they had to be tested. So like you said, so many people are not taking it seriously. And I'm thinking, if we're having such high numbers of reports and building closures, because some people are opting to go into the school to teach, some people like the secretaries or others, I guess they have certain days that they come in, but we don't even have the factor of children coming back to school yet. This is just not even 10% of your staff that's there. And I'm just saying, look at how quickly something was spread just with maybe less than 10 people in a building. So that's what's scary to me. And then people don't want to wear masks, or they don't want to do other things. And that's why I'm not going into the building, because I can't say that with that few number of people, and if people are social distancing and wearing a mask, then how is this still occurring with that small a number of people? Because right now, because of the phase we went back into, you can only have a certain amount of people in a building, but then you still have people that are testing positive. So that just lets me know how serious it is. Just that small amount of people being in something as big as a school building. and it's still spreading the way that it is. So it's like, how could you not take that seriously? You know that if there's numbers, like if there are people 50 or 100 or more people that are meeting, that definitely, you know, increases your risk. And because I have type 2 diabetes, I'm in the high risk group. So then I'm very careful in even going out.
Oh, okay. Excuse me, and I apologize, the Cannons. I wasn't aware that, you know, you were all panelists. I was just made aware, you know, by Chris. And would you like to answer any of those previous or add to those previous questions that was asked?
Are you talking to me?
Yes.
I'm so sorry. I thought you were talking. Well, yes, and I've had 2 family members to pass. I had my aunt in St. Louis, my great aunt who died. And also I have a friend of mine. We started teaching in Baltimore City together back in 97, 98. And she passed back in June. She also had an underlying condition. So it's just, like I said, just being in the high risk group. They're having something at our school, and we're taking things up to the students for our homerooms for them to have for winter break. But when they do the distribution, I won't be there because I'm in the high risk group. And like the gentleman was saying earlier, I don't, this is something, if you take a chance with this, you don't know the level of severity, you know, in which it's going to affect you. So it's not like something where we can determine it, and I don't want to find that out. So that's why I'm just surprised at the level of, I don't even know if you want to call it ignorance, but just people are just so, I don't even want to know if I say naive. Like, you see the numbers. If 3,000 people died yesterday, what makes you think that something won't happen to you? So how do you take for granted? Why are you not? And like you said, it's not just about you. If I am practicing behaviors that are not safe, then those behaviors, it no longer just impacts me. I have to think about how my behavior, how does it impact other people? So I just can't believe the level of selfishness. And we have people, I'm not getting into religion, but I'm just saying, you know, you call yourself an upstanding citizen, you call yourself a Christian or whatever your religion may be or your beliefs, you're a morally good person. But then you can do something like this that endangers other people's lives. Like, I don't get it.
Thank you for inviting us on the panel today.
I had no idea.
That's okay. We've been enjoying the conversation. I'm Kimmy Cannon, and this is my husband, Terrence Cannon, and we live here in Houston, Texas. We attended Texas Southern University, marched in the Ocean of Soul marching band.
Okay.
The old Ocean.
Okay.
But I've been hearing a lot of people say that they know someone or they know of someone who's contracted this horrible disease. Well, my husband and I are survivors, and we were doing well. You know, as of this spring, we have 2 sons that are currently in college, and we gave them the rule. You know, we know your hormones are racing, but put the mask on and cut down the socializing. Everything was good up until September. And we thought our son was sick because it had been raining and cold out the night before. So I started taking care of him like it was a cold. And we saw his fever wasn't changing. He ended up having to go to the doctor. The doctor says, you need to go take a COVID test. He takes the COVID test. Guess what? We find out he's positive. And I've been waiting on him hand and foot. Hubby's been waiting on him. Now we've touched everything. And that's how it started. He got it first. My husband got it next. And I got it next. All 3 of us were sick for several weeks in this house.
Oh, wow.
And we had our other son that took care of us. And it was very, very difficult. We have 2 daughters, one in New York who graduated from Columbia and another one here in Galveston. And they, along with my sister-in-law, my husband's sister, they together set up a spreadsheet of how to take care of mom, dad, and brother. So I'm here to say, to answer your question, and my husband can ad-lib to it, is that having lived through it, I would not wish that even on the one who's the prior president. I mean, it was horrible. We dealt with cognitive issues. We dealt with breathing issues. We dealt with short-term memory, still having that. I'm just now getting back my smell and taste from October.
Yeah, it was end of September.
End of September,
Yeah.
yeah. We lost weight, and we all can go for that with the quarantine weight. But it was horrible, and I just thank God that we are here and we're living proof that you know, it wasn't our time. So all of you all who have not contracted it, thank God, and all of you all who have and made it through, you know, thank God. And my husband can add a little bit more.
Yeah, you know, for those people that refuse to wear masks, you know, you grow up with a certain idea that there are a number of stupid people in the world. But this has taught me that it was way more than I thought. It's a lot of stupid people. And it shows us as a nation how frail we are. If we ever ran into a tougher situation than this, I don't know if we'll win. I don't know if we win. So I'm praying for this country because, you know, it's a lot of times you hear minority children educationally were left behind. I see we weren't the only ones that were left behind educationally because there are a lot of stupid people, a lot of people that can't put two and two together, a lot of people who don't know fat, meat, greasy. And it's like, it's hurting our country. It's really hurting our country. So thank you all for inviting us on here. And please wear your mask when you go out. It's going to save your life.
I just wanted to quickly add in what I think Ms. Simmons said about the seatbelt, you know, and other things like that, where you don't think about it, you know, you don't run the red light. Because I have a right and I'm an American, I'm gonna run the red light today. You don't do those type of things. So I don't, you know, we're here in the South, and to hear people say they have rights not to wear a mask, we still go into the store sometime where it says don't wear a mask. I think Mr. Jeffrey Fuller, you said something about you saw there was a sign that said you can't come in without a mask. Well, we have the bold ones here who still see the sign, and they come in.
Oh, yeah.
And you kind of don't want to be a tattletale and go find the manager, but when they come near you, you just do this, back up. I think Mia Edwards said, back up. You know, don't come near me. If you decide to break the law, don't come near me, because I would never want to deal with that ever again.
Well, we're in Baltimore, Maryland, and I don't vote Republican usually, but my Republican governor, Hogan, has it in writing as a slogan: "Wear the damn mask." He's not playing. He's not playing, and he's been anti-Trump about this whole politicizing of the situation. So, and he's not looked on highly for it, but I look on him as a man who is realizing that he's in a public office that serves both sides. That serves all people. So we have to look at it more so along that. And I'm gonna get off in a minute because I told our good moderator I have to play daddy Uber for my kids. We all know how we got to do that, right? But brother and sister Cannon, I'm a survivor as well. I was hospitalized myself and unconscious for about 3 to 4 weeks. But let me tell you something, and I'm gonna say this wholeheartedly to my good people. And Brother Ward, I still gotta get back with you, man. Don't think I've forgotten you. I did talk to Chris about you, but I just didn't get your info. That's my fault. That's my fault. And I still got them crabs for you. Don't worry about that. I still got them crabs for you. Coming from this background here in Baltimore, where we're the line of the South considered, even though we really consider ourselves Northerners, we are truly the South. It doesn't matter where you're from, where you at, what your economic status is, what your race, creed, color, religious belief is, whatever it is, wear the damn mask. That's what my governor says, and I'm listening to him because I'm here today because some people wore a mask and protected themselves. And yeah, I caught it. Okay. I went through a rough patch and I'm back, and I'm ecstatic to be here because it took me to death's door. But I'm right now saving a space. I don't have one tattoo on me, but I got a space right here on my arm waiting for the one that's going to say the word grateful, because I'm eternally grateful for the angels that God has put on this planet to be in front of me, to get me where I am today in my recovery, and hopefully in my testimony and message And the Cannons, I'll be reaching out to you for some of your info. But this needs to be something that we spread out there, and we say more to our people, no matter who we are. And I say my people as in the human race, because if we don't protect us all, we gonna have a serious problem with this thing. This thing is gonna wipe people out.
Before
And
you go, tell everybody about your podcast that you want to start too in
oh
January.
yeah. I'm starting a podcast for my testimony. A friend of mine said, he heard my story for the first time from start to finish. And how in this case the Cannons were talking about their family had it. Well, my wife got it, and my oldest daughter got it. She's 22. So both of them were staying in the house the first 2 weeks they found out that they were there for being quarantined. But I was already in the hospital under heavy sedation and unconscious on a ventilator. So they not only had to worry about themselves, they were worried about me on top of that, and then worried about my other two daughters, 20 and 13, who had to take care of both of them and still worry about me and worry about them. So a lot of complexities going on there. The thing I wanted to do with my podcast is have that discussion about those complexities. Have that discussion about how when Sister Cannon was talking about it, I went through a whole mental blame game about me bringing the disease into my house. And now it's my fault that everybody in the house is sick. So now my wife's like, it's no big deal. Don't worry about it. Never discussed it again. And when I told my daughters I was going to go get some counseling, they were like, Daddy, how can we forgive you for something that we never blamed you for? But I still feel it. I still have that feeling inside of me that I did it. Just like I would brought a cold home. It's just less ramifications. Here, I'm on my deathbed and I'm thinking they get ready to come behind me to be in the hospital again. And then they're seeing me in the hospital and now they're scared that they're going to go that route. But we don't know because it affects everybody differently. Plus, we want to talk about how we affect my podcast. We want to talk about how we affect people mentally after the fact and how we're going through our own PTSD. Because this thing, once you had it, like I was saying earlier, when you have something that somebody else has or been through an experience somebody else has been through, you can talk to them about stuff. And they hear you because they've been through it. And I think if we get enough people together that have been through it to discuss it and to talk about it, we'll have a platform where we'll be in a position to hopefully spread more good word out so that more people will listen. Professionals like our good sister Ashlyn, so she can be there to advise people professionally on how to respond to these things. And then people like us, myself, the Cannons, and others who have been through it, to say to people like you, Miss Edwards, you may not have been through it, but you understand how important it is to be safe because you don't want to go through it. Because honestly, I don't want you to go through it, sister. I don't want you to have one moment in a hospital, one moment where that nurse or that doctor got to look at you and tell you you got COVID, and then they got to deal with you crying for the next 45 minutes straight and you don't know what to say out your mouth. And you can't even get out of you the emotion that you need to say, hey, what do I need? Calm yourself down so you can be clear and concise on what you need to do medically. No, your mind is shot because you're thinking the worst. And I wouldn't want to put that through anybody. Teachers, especially, Miss Alicia, I'm in Baltimore City. Let me tell you, I don't encourage no kid to go to school. That social aspect is beautiful, but I'd rather you be socially deprived than be deprived of living. And I pray that these administrators, or rather the people at the top, start to pay respect for the fact that the teachers need to be protected, the administrators in the school, the secretaries, heck, the janitors, the cafeteria lady, the custodians, anybody who works in that building is a possible link to either A, getting it, or B, spreading it. And if we eliminate that, we can move forward. So again, podcast, I'll let you all know about it, and love you all dearly.
Before you go, if I could say something to you, the one thing that I will offer to you is, and it's easier said than done, but being gentle with yourself, and that goes for all of us. For you didn't know that it was going to get to that point,
Yeah.
And if you continue to blame yourself,
Mhm.
you know, the hurt is going to continue to be there. And I think the
Right.
one thing that I continue to tell like myself and my clients is that, you know, it's hard to forgive ourselves for something.
Mhm. Mhm.
And that's where it starts from, knowing that, you know, if I'm gentle with myself and if I know that I took every precaution to protect myself and my family, I
Mhm.
did what I could.
Right. And I respect that, and I thank you very much for those kind words. And I have to let you know that my counselors were saying those same things to me. I got out of the hospital in September. I've been in there since July. Uh, so to hear that now, to hear that then would have been helpful. And I mean, I would have really taken those words to heart. To hear it now is reinforcing the encouragement I got from my counselor. So I appreciate that. And I think we are our biggest critics when it comes to our children, to our families. I know as men specifically, Black men, we want to be considered the heads of our households, but more importantly, we want to be considered the compass of our family. I know I do. And I want to make sure that if something happens, it's going in the direction that I'm trying to steer my family in. My wife is on board with that, but at the same time, she's also of the ilk of saying, "Hey, if you're down, then we got to take care of this business, and you can't blame yourself." To hear it from the people who love you, that you feel you're trying to protect, they're the ones who got me through it. And again, the counseling and the being gentle to myself, I had to learn that, and I think that's something that we need to communicate the bad part of it first. But yes, Miss Edwards, that is very, very encouraging to know that other people feel that way, and will encourage me. I guess I wouldn't have heard it 2 months ago, 3 months ago, but I appreciate it so much more now, knowing that I got the counseling I needed in order to get me to where I am today. I'm fine now. I mean, I understand where it is now, but I appreciate that. I really do. I really,
Jeffrey,
really do.
thank you.
Thank you.
Jeffrey, thank you for telling us that. And Maya, thank you for raising that point, because what we didn't tell everybody was our son was the one who was in your
Right.
position.
Right.
He's
Right.
been following the rules, and he got
Right.
around somebody and did the wrong thing, and he dealt with the guilt. He's 22
Mhm.
years old.
And
So
you
he
forgave him
dealt
instantly.
with the guilt. Right. He was carrying
Yeah.
the guilt, and we could tell it was tearing him up.
It does.
And it just seemed
It
like
does.
his whole world was just crushed,
Yeah.
because of it. So
Just
you're
keep
right.
him in prayer and keep him
That's right.
encouraged.
That's right. You got
That's
a
all.
lot of dynamics
He
going
has to.
on.
He has to hear the words. It's no
Yeah.
big deal. We're fine.
Yeah,
God
but
got
see,
us
when
through it.
when his dad ended up in what Mr. Kennedy didn't tell you all, he ended up in the hospital. So
Right,
now it was
right.
looking like, oh, you know how it is on the news. You see people going to the hospital, they don't come out.
Yeah.
So
Yeah,
now
don't come
he's
out.
thinking this is the end. So like you said, I'm trying to heal, son's trying to heal, dad's in the hospital. It's some emotions going on,
Yeah.
man.
Yeah. It can be
And
tough.
it's like the song, I never would have made it without the Lord. Honestly, it took a lot of prayer. We didn't know what
Well,
we was praying, because
mhm,
like your mind is not there. You know who you are. I want y'all to hear me. You would look in the mirror and look at yourself and say, who are you? I know who you are, but who are you? Where am I at? That's how you are mentally.
right.
That
Right.
disease takes your mind. So you
Right.
don't know what you're thinking. So thank you for bringing that up, Maya. And thank you, Jeffrey, for letting us know that what you went through, so we can pass that on to our son.
Well, make sure y'all go online to look up. I think the song entitles it "To the T" for me, and I think it'll work for everybody who's been through it. The song by Marvin Sapp called "My Testimony." Let me tell you something. If you want to jerk a tear out of brother real fast, all I got to do is play that song. It tells my entire story that quick, that easily, that simply in the 3.5 minutes that he sings. So powerful. The words themselves, you can read the words and you would understand it completely. But Marvin Sapp does a great job on the song. I encourage everybody, please listen to that. If you want to, go to my Facebook page. It's on there because I believe in that. And again, being grateful to have this opportunity is what I am. And I appreciate each and every one of you. Please, you got any questions for me? We're gonna reach out. We're gonna talk more. We're gonna network, because this is how those big banks do the ill work that they do. So why don't we take the same technique of networking and do some good work with it?
Jeffrey, I have one question before you leave.
That's Morgan State University, the magnificent marching machine. Just want to let you know.
Okay.
Just want to let you know, bro. Yeah.
What?
Y'all never came up our way, but we'll come down there if we need to.
Yeah. You didn't want none of us back in the day.
Oh, no, wait, hey, I didn't say that. I said today.
Yeah. So the question was, and I need to know, because I feel like I've aged years. I feel like I've aged years. You know, me and my wife, we've been married over 30 years. And you know, you communicate with each other in the house and you're like, do this or do that. Can you get this? And you forget.
Okay.
Just, as soon as you talk, as soon as you say another word, you just forgot what you just said.
Were you under sedation when you was in the hospital?
No, I didn't have to go under sedation. Thank God. I only spent 4 days with double pneumonia.
Okay. So I had walking pneumonia when they walked me in the door. And my oxygen level was at 60%.
Wow.
So they put me in immediately, and I was in for 2 weeks. They put me out. I breathed on my own for like 2 hours. I stopped breathing. They brought me back, and then they put me back in sedation for another 2 weeks. So I'm with you with the short-term memory loss, because instantly my wife can say something to me, and I'll be like, huh?
Yeah.
Exactly. She looked at me like, I just told you 30 seconds ago. And I'd be like, what you? So I'm just going to be a beat down husband. You know? I'm just taking it.
Well, and we have to remind ourselves that if I tell my wife, if I ask her to do something or she asks me to do something, we have to remember COVID just took our memory, not to get upset because I didn't remember.
Right.
What you just told me.
And equally when you ask her to do something, because you'll come right back and say, babe, did you do so-and-so? And she's going to be like, you just asked me that. And I was like, no, I didn't. And I swear I didn't. I swear I didn't. Bro, it comes back. It comes back. It's a slow process. I can only tell you, be patient with yourself. And if you got a loving wife.
Because that helps us to become, I'm just thinking about people that I'm around. I'm just saying that may have had it. When we do resume work and other things like that, sometimes we may unconsciously say to someone, don't you remember, why can't you? And it's like, we don't know who has had COVID. So you guys have made me aware of, not even just at my job. I'm just saying, when we return back to regular society, we don't know how many people have been exposed or what, the residual effects are. And so now we've got to start being gentle with other people who may have had it, because I'm gonna be honest, before this seminar, I wouldn't have ever even thought about that. People are still dealing with, I mean, I hear about it in the news, but you guys are a testimony. People are still dealing with the residual effects of this, and this is long-term. So everybody else has to learn how to be patient and forgiving, of things, because we may have the same pre-COVID expectations we have, and the world will never return to that.
Yeah, like so you guys said,
letting us know about that.
Oh, sure. And you guys, the Cannons, y'all said y'all lost weight. Well, I lost 50 pounds. Wow. Just laying there. So to come out as a whole different dude, and people like, "Dag, man, what happened to you?" I had COVID. Oh, really? Oh, I'm so sorry. Well, because at first they saw it as encouraging because I just lost weight, but this isn't something you want to. I'm not going to make an infomercial for the low price of $19.95. You too can lose weight. That's not happening. Not your boy. It's not happening.
Not like that.
Yeah, I mean, if y'all want to lose weight, let me tell you, y'all can do 1,000 other things that still don't work, but I'd rather you do those things. Because this was between the weight loss, the anemia. I'm always cold. My arms are always cold. The strange part, especially when you're hospitalized, your skin sheds because you've lost so much weight. So I have basically, like a python, shedded skin in my arms, my hands, my legs, my feet, all new skin. And I'm just looking at myself like, wow, blemishes are gone because the skin is gone. And I didn't know that was going to happen. The sense of smell, the sense of taste, mine comes and goes. So, sometimes it's good, sometimes it's not. But please be aware, there's so much. And if you just be calm and look at somebody and ask them, hey, what's going on with you? They'll tell you. And if we've had COVID before, you'll know. Because we'll look you in your face and be like, hey, man, I'm a COVID survivor. And once you say those 2 words, people start to go, really? What happened? And then that's when you can educate them. And that's the key. They just have to be open-minded enough to want to be educated. So.
One of our panelists has to leave, Mia Edwards. She
Yeah,
has
and I'm out too.
obligation, and you're gonna be late, Jeffrey, picking up your baby.
Oh, I already texted her. She's still in the store shopping. It doesn't matter. I'm gonna be waiting 20 minutes for her anyway. She gotta count the register. That's what they do.
Oh, okay.
Hey, y'all have a blessed rest of your weekend or a great day, and have a merry Christmas. And please be grateful that your family, what you have of it, is here. Just be grateful.
Yes.
Jeffrey, you looking well, man.
Hey, Brother Ward, I said I'm gonna get with you, bro. So we're gonna give me before Christmas. I'm still working on some things, but I'm gonna get with you, man. Chris got me. Me and him been talking, but we're gonna get together too, man.
I'm not
Brother
going
Cannon,
nowhere.
Sister Cannon, trust me. I ain't say nothing about being with y'all, but you come see me. We got plus Fred, I gotta holler at you.
You got it, man.
All right, hey, y'all have a great rest of the weekend.
Hey, brother.
Great holiday.
You too. Thank you. Okay. I have a question for the Cannons. Have you considered having counseling for COVID-19, especially for your son, because you said he dealt a lot with the guilt?
Our daughter did mention it to us, that, we should possibly do that. She gave me the links to a couple of things. I didn't per se look too far into it, but I did join a, how do you say it? Some type of survivor group, support group, and just went in and saw some of their testimonials and how they dealt with it. And it was very beneficial. It's so funny, but it's not. We thought once we felt better, that was the end of it. Nobody ever talked about the residual effects on the news. At least I didn't see it. So when these things start happening to us, it was like, wait a minute, what's going on? Do we still have it? So we had no idea we needed counseling, but
it's a thought.
It's a thought, definitely for our son, because 22, they're already dealing with a lot of stuff anyway. They're angry. They can't see their friends. They can't go out and be with people. They can't go finish school how they wanted to, so it's a lot of things going on. Yeah. But we will definitely consider that.
And we fortunate where, like a lot of people live in a house where it's just them, or they didn't experience. We have each other kind of, as a support group to share. Are you dealing with this? Have you been experiencing this? And it's helped out a lot, because we already were close, but it helps bring us even closer to what our frailties already. Like, you want to be sensitive to somebody if they not able to do something they used to could do easily. And you realize this is still COVID. This is still, I'll be glad when the forgetfulness goes away, because I went back to work, and I worked for the government, and it was a national holiday, and I'm on the computer wondering where everybody at. And it just never it never came across my mind, this is a federal holiday. You're not even supposed to be working. And, I read things, and it's like I have dyslexia. I'm trying to input things in the system, and I'm wondering why isn't it coming up? Why isn't it populating on the screen? And just 2 words, and I just switched them like that, and didn't realize it took about 6 or 7 tries for me to finally say, what's going on? And wow, oh my God, it brought a tear to my eye, because I said, oh my God, what's going on with me? I've never been like this before. And I still deal with it, and I'm like, I'm just not used to this. I never been this forgetful. And it still brings a tear to my eye, because I'm just not used to being old. I feel like I got 5-10 years older mentally, going through this thing that just occurred for like 3 or 4 weeks. So I hope no one else is experiencing that, but everybody has different experiences from it.
Okay. That's good to hear. Okay, now my next question, I think anybody could probably answer. What are your coping mechanisms on dealing with COVID-19?
I
Wow.
I could go, or Mr.
Go
King.
right ahead. Go right ahead.
So a couple of coping mechanisms that I've been using is one, limiting or at least attempting to limit how much social media I'm on, and how much of the news I watch. Um, for me, I think when I'm watching like the news and I'm seeing how many people are dying from the virus, it just puts me at a place of numbness.
Yeah.
So that's one thing, and the other thing, and which is some of the typical things that I would suggest to my clients, is finding some things that they can do for self-care, whether that's taking a shower or doing things that you love to do. Um, since some of us, we will say, are practicing social distancing in that house, there's a lot that we can be doing, a lot of growth that can be happening within ourselves. So that self care and limiting the social media and the news has really been helping me. And also, some of my teams that I've been talking to has been helping them out in a particular way.
That's great. How about you, Cannons?
Well, she's definitely right about the news. Oh my God, too much CNN, MSNBC, Fox, too much of that, it'll just drive you crazy. And sometimes I find myself just having to turn it off and look at cartoons. I need to find that happy space again, so yeah, definitely.
We did some, well, I've done some mental games to try to strengthen the cognitive capabilities back. Exercising, the doctor finally gave the good for that, because we were having breathing issues. So now we're doing that. But she hit on the social media. I haven't been back on Facebook since this happened. And I'm over a women's organization group, and I said it's shut down for the year because I just wasn't ready to. How can I say? I wasn't really ready to laugh and smile about anything. Thank God I was alive. And my grandmother always told me never question God about anything. So it was really for those of us who are faith-based, took grace to get me through, our whole family to get through this, because you are angry. And for us, that's a big thing. Supporting each other, staying prayerful, keeping faith, and trying not to be too judgmental of those who don't quite get it. You can say all day to your blue in the face, wear a mask, but until it affects them close, they're not going to get it. When they lose somebody, they'll get it. So we just have to just, hope and hope and pray that they turn around.
Yeah, and it helps, a lot to stay in touch with your friends, to talk to family. It helps a lot to communicate with we got children all over the country. And it just helps to reach out to them and talk to them, frequently. It helps kind of take your mind off of it. And they understand. They understand and sympathize with you and help counsel you.
Yeah. For me, some of the coping skills that I've been using beyond just limiting news, limiting social media, helps me like stay focused, stay present with my husband and with my family. We got a new puppy a few months ago, and so she's always a welcome distraction whenever you're feeling down, you're feeling overwhelmed, the world's a dark place. You just go play with the puppy. It really, and get some exercise, help her get some energy out is helpful for me as well. But one thing for me too is just running. Running has been kind of my go-to since quarantine has started. I used to get terrible shin splints and I just couldn't run. Like my body just has never been running. Like it's never been something that I could do. And since COVID started, I've been building up that endurance. I've been going and going. And last week I'm at the point I ran 7 miles in 1 hour. And so I ran for an hour straight without stopping. And last year I'd be struggling to run 1 mile. So that's something that I've been doing because there's research that shows that stress stays in our body. When we experience stress, it stays in our body, and we have to finish the stress cycle in order to release that stress so that we don't carry it in our chest and in our gut. When we're scared, when our safety is threatened, we hold that stress in our gut. It can give us digestive issues, IBS. It can cause all sorts of trouble with our digestive system. When we are triggered into a fight or flight scenario, we've got that adrenaline going through our body. That's our chest, that's our heart. Our breathing is fast and all of our muscles are clenched together, ready to run away or to fight something. Well, you can't run away from a virus. You can't fight a virus. You've got to find a different way to cycle through that stress, to get that adrenaline through your body physically. And one of the ways to do that is through exercise, through whatever degree your body is able to do, whether that's running, whether that's going for a walk, something to get your body going that afterwards it has physically needed to relax and breathe. And it triggers your body into knowing we're safe right now. I'm okay. You can start doing those deeper breaths, and it's kind of like a reset.
Okay.
Yeah, I just, for me, I kind of do a lot of everything what everybody else has kind of said. But one thing I like to do, sometimes
You're frozen. Oh, there you go.
school hip hop when I was in college, so that kind of helps me feel a little less stressed. And I do also limit my news, watching how much I watch, because intaking too much negative can bring a person's spirit down. And so I try to find a lot of humor. I watch a lot of, and my family gets on me, TikTok videos, because some of them are actually kind of funny. And and so I'll send my family some, and my daughter's like, "What daddy doing on TikTok? He too old to be on TikTok." But the thing is, some of it is really funny. And so I try to find a lot of humor in different things. And some of the clients that I'm over with now, they like to tell jokes. And so I try to remember the jokes and share them, or share jokes I've heard. So that's kind of some of the things that I do to try to cope with this, because it's very frustrating. If we're just sitting down thinking of all the negative things that's going on, especially with COVID, and you become frustrated. And before you know it, you're sitting there just kind of, feeling down and feeling bad about things. And so we can't have our spirits go down like that. So that's kind of some of the things that I try to do to kind of uplift myself as well as other people.
Okay. Anyone else? No? Okay. My next question, Anthony Ward, we'll go back to you. Are there any new policies that have been implemented that you would like to see stay, and why?
Well, as far as my company, what they've done is they've had us, and they've always said it, but they're really starting to enforce it. It's just the wearing of the mask. And even like now, I'm in our day program, our day treatment program, and every time I look up, I'm having to remind somebody, okay, put your mask on, put your mask on. And at one of our clinics, they've had a therapist to test positive, and they had to close that clinic down. And so luckily for me, it's not in the clinic that I'm in. But that's what I emphasize to the clients. Look, guys, we cannot control this virus. The only thing we can do is control what we do to try to handle it. And so they really encourage us, and they've made it a policy that now they want you to wear your mask whenever you're around somebody else, even if you're 6 feet apart. And so I'm hoping that kind of just the importance of trying to remember the steps to take to try to keep yourself and others around you safe. I'm hoping that sticks around even long after we've gotten the vaccines and this thing is kind of dying down some. And just the fact of people remembering to cover their mouth when they sneeze or cough. I think that's one thing about this virus that has kind of helped us in a sense, is now we're more aware of how much we weren't really covering our mouths, covering, washing our hands and cleaning up, just basically making sure things are clean. Even when it looks clean, take something and wipe a Clorox wipe over it just to be safe. And so I think that's made us more mindful. So I'm hoping that kind of thing continues, the seriousness of what we need to do on an ongoing basis. I hope that's what people remember after this has kind of died down some.
Okay. How about you, Miss Ashlyn? Would you like to answer that question?
Yeah, I'd love to. Some of the things beyond just what Mr. Ward was talking about of, personal hygiene, safety, things like that, just to protect everyone, even after COVID's not being spread. One thing that my agency has done is, so we've moved all of our therapy services online to a virtual setting since this pandemic has hit back in March, and we will be virtual through the end of spring or until a vaccine is widely available. And so one thing that I know I will be continuing throughout my practice is I will be continuing to offer teletherapy services even after we have the option of meeting back in person again. Doing virtual services, I've been able to reach more people that are in need of mental health support. I've been able to reach people that might have transportation barriers where they can't drive to the office, they can't make it to an in-person location. Perhaps they live in a more rural area outside of Austin. As long as they've got a Wi-Fi connection and a phone, they can jump onto the session. And also it's been helpful for some of our working parents too, if they've got kids that, get sick and they've got to keep them at home for the day. Well, normally they would have to cancel their therapy session because they can't leave the kid at home, but they can take 50 minutes and kind of step out and into another room and do their session. And if their kid needs something, they can always step in the other room and help them out for a little bit, but then come right back in. So I think that's been helpful even beyond COVID. Just having that teletherapy option, whether it's a permanent option or just even a one-off for a week if somebody just needs continued care but can't make it in person.
Okay. And I think this question could be for anyone. Has COVID-19 made any permanent changes in the way you live now versus before the pandemic?
Absolutely. My sons, my two college age sons live with us. So I told them nobody comes over. Nobody absolutely comes over our house. But I told them that after this is over, if I don't see a test showing that they're positive, they still can't come in my house. I don't feel safe going to the grocery store or anything else. Since I think the end of February, I've been teleworking at home, and it's just different. It's different. I have to make myself go out and walk because I'm not getting enough exercise. I find myself waking up super early in the morning, 5 o'clock, 4:30 a.m. And I have a routine where I'll stretch in the morning, just looking at TV and stretch before I get my work day going. And it's definitely changed. It's definitely changed. So I got to find a way to be more active instead of sedentary, because working in the office already, you kind of sedentary because you're sitting in front of that computer most of the day. So I find myself having to create activities, and my wife, she'll get in like 10,000 steps a day. Well, prior to COVID, that's the other thing we didn't mention, was not just the shortness of the short-term memory, but your stamina. You don't have it like you used to. I started trying to shoot a little basketball, And after bouncing the ball for 5 minutes, I was winded, like I had just ran a marathon or something. And it's definitely limited what I do. It limited to what I do. Instead of cat naps, I'm taking longer cat naps during the day, because I'm trying to find that energy. Where's that energy at? It's not where it used to be. So I think as far as who comes and visit now, I think that's forever changed. We're not gonna have, everybody's not gonna have the vaccine at least till what, maybe next fall. So that's a game changer. You still not coming in my house. Nobody's coming over, and it's hard for us to go visit people. We played in the marching band. We're band heads, so we used to going out to the games on weekend and socializing with lots and lots of people. And now you can't do that. You can't see anybody. So it's been a struggle. It's been times where I just got so fed up with being in the house. I said, I'm finna go driving. I just got to get out this house. I got to go somewhere. I just need to see somebody. I need to do drive-bys at friends and just wave at them, because it's a different world, and we're still trying to adapt. We're still trying to adapt to it, because we don't know how much longer we're gonna have to deal with it.
Okay. Okay, anyone else?
I would just say for me, I live in the Chicagoland area. I think what's going to change for me is our numbers have been tremendously high here in Chicago. It's like 11.5 right now. So strategically planning my day, I don't just run out the house to go to the store. I got to make a list and hit everything when I'm out. And I have to really plan my day, because when I go out, I want to get everything and come back in the house and kind of quarantine for a couple of days. So to me, it's not, I think that's going to be a constant until, like somebody said, till we get a vaccine, until there's a cure. So it is no more just running out the house to the spare of the moment, going grocery shopping or going to Walmart or Target. Like I have to really plan my day and really plan what stores and things that I go in. So I think that's really what's going to change for me. And like the Cannon said, nobody can come over. You can't socialize anymore. So that's really going to be a game changer as well.
Okay.
Well, hey, how y'all? Well,
Hello.
I'm Felicia. I live in Houston, so I am that teacher that has to report in. I'm on the leadership team, so I really have no choice as far as whether I am going to or whether I'm not. Fortunately, on my campus is one of the lowest campuses for COVID cases. We do have some, but the cases that we have been from students contracting from the parents, and the parents probably knew that they had it and just refused to take the precautions and not send those children to school. I am a part of that hazmat team for I work with the nurse. So I have a lot of contact. And so when that thing comes, like I've had so many COVID tests that I've had to go and take. And I mean, just for my precaution, because I was one of the ones that had to deal with those students going to pick them up from the classroom. Now, one thing that we do have in place on our campus, which I think has really worked, because my principal, like, she's like one of the ones that's really adamant, like, we're not gonna have these cases, we're not gonna do this. This is what our protocol is. And if you feel like you don't want to follow this protocol, then you can stay at home. We don't even need you. We can get some more people in here, because unfortunately we have to work. One thing for sure, we have the list of all of the symptoms. We don't even care if you have a runny nose, you can cough, you go into the office. Those teachers getting you out of the classroom, you're going to room 1, you're going to go quarantine. We're going to check your temperature. If you have a 97.9, you have a 98.1, you going home. You're not coming back until 10 days or until after 3 days when you go and take a COVID test and it says that you're negative. Now, the students who have been positive. It was a family of 3. All of 3 of them tested positive. They came to school, they had a fever. We caught the fever right at the beginning. The teacher noticed, the symptoms. They had to flush eyes and different things like that. But unfortunately, our very first case was of a student, and we've only had one teacher we only had one case that was in a contact from the student, and that teacher unfortunately passed it along to her parents. So like you all are feeling, the Cannons, like your son is feeling like it's my fault. That's how she's feeling right now. It's her fault. And I've really been on the phone with her like all day today because unfortunately her dad passed last night.
Oh,
And so she's my mentee. So I mentor her. This is her first year teaching. But, it's just keeping things in precaution. So yes, they have the Lysol, they have the spray, they have the this, they have the that. But it's just the main thing that you really have to make sure that every area is sanitized, everything is clean. If you suspect anything, get away, you go wash your hands back to where with your sanitizer. I don't suggest, and I tell everybody, I started off in the health field before I became a teacher. Because I got a little fast in my last year of college, I had a baby. But unfortunately, I ended up with here in Houston. I'm teaching, but I'm not teaching. I've been out the classroom for a while. But every day that I walk through that door, I have the precautions. We take those precautions with my kids who are going to school also. They have their hand sanitizer, they have their bottle of soap. Before they walk into the house, like we're spraying down the doorknobs, with the light switches. I mean, even when we go into the car, I'm spraying down the door handles because you never know like what happens from touching one place at your job to coming to home or to your vehicle. So it's just a lot of precautions that has to be taken. And unfortunately, this is what we have now in this world of 2020, 2021. And it's just the fact that we just have to adapt to it. Like you say, like nobody comes to my house. And if they do come to my house, it's going to be because they're going to come and we're going to stay for a long period of time. So that means you're a part of my household now. So it doesn't mean I don't have visitors. But we unfortunately, yes, we do still go out because the world's, and I can't afford for everybody to deliver my groceries to me. So I have to go do that shopping. But if I go to a place and I notice that people are in there without their mask and things on, then I realize that that's not the grocery store for me. So like here, HEB is like my number one grocery store because they're really adamant about masks. And they don't do that thing like people say I have a health issue. They're not following that. Well, then maybe this isn't a grocery store for you because everybody here is going to be masked up. So and I listened to the Cannons and like what they were saying, and then the guy that had to leave. So it was just like I understood exactly what they were saying, not because I've had to deal with it personally with my family, but just because I have this 22-year-old teacher who just lost her father and almost lost her mom, but her mom pulled through, but dad didn't. So it's like, this is my child, that I've had to help. So I'm like, I'm taking things, dropping things off, with meeting her at the gate, waving bye to her. And, when I'm coming texting her, I'm outside because why? She doesn't have family here. They moved here with her for her job. So like I'm that family, I become that family member with her. So it's been rough, but this was my first time ever dealing with someone on a basis. Now, yes, I've heard of cases, I've heard of my other friends saying, but never firsthand of what it really impacts on someone. So my heart goes out to everyone, and I just pray that everyone, continues to be safe. Like I say, wear your mask, use your hand, your soap. You know, it's really funny. Like now we're telling everybody be clean. Like for real, we got to teach people on how to be clean. But I guess, you know, that's just what it is. And I never thought that like this was a joke, like Ward said, like, you know, it was a conspiracy. Now, this wasn't a conspiracy, but it's just something that, you know, that is real. And we have to accept it and start making all necessary precautions to protect ourselves and to protect others. That's it.
Thank you, Felicia. We enjoyed your statement. Okay, I think this is probably our last question for the day. And what are your holiday plans for you and your family during this holiday season? If you can give some ideas how to make the holidays more fun for your family, please share.
I'm going to Dumas. I already have my mom said the only way we could come, we have to bring our test results. So we're going to go get tested 3 days before and then 1 day before to make sure that we're still negative. And we'll be in Dumas. I told her I need to see her results too. Because not just mine. She talking about, no, y'all the red state. I'm like, them Razorbacks, y'all down there kind of popping off too over there in Arkansas. But but that's what we're gonna do. I just hope, I mean, normally, you know, the holidays is normally a time where all of the family members come together, but unfortunately that's not gonna be that issue. But for the immediate family, we are coming together, the ones who aren't going to be able to make it because she is limiting the number amount that's going to be in the house. So we'll be doing a lot of virtual things. We have a lot of virtual games set up. We've done some trial runs with them to see how they will work. And that's the way it's going to be since the gifts and things won't be exchanged. So we have electronic gift cards that we have set up for the ones, because we normally do a lot of games where, you know, they win the prize, they go get the gift. So now we don't have the gift. So we have the, like I said, the virtual card. So as they win the games, we'll send them privately through the chat their code so that they can go get their gift and see what they won. That's what we plan on doing over here.
I'm writing that one down for my family. It's a good idea. Miss Ashlyn?
Yeah. So for the holidays this year, it's going to look a lot different with my family in the household. My husband's family typically does a big, you know, get together Christmas night, gift exchanges and games and dinners and stuff. And we're going to move that virtually now this year. Instead of going to see my grandparents out in Dallas, we're going to be doing a porch visit with them because I'm in Austin, so just 3 hours. So we're going to go up there. They can stay inside in their warm dining room or living room, and we'll be outside just on their patio waving, just giving them a small gift. So it's going to look different. But we're excited to see people that we can. So yeah. One thing that my family does, it is a tradition of ours. We do a annual lip sync battle. We've done it for about 6 years now. And this year, normally it's in my mom's house. We have a whole backdrop. It's a whole thing. We bring in guests and judges and stuff. But my mom has rented out a venue for this event. She's been saving all year for it, looking forward to it. So she rented out a venue where we're bringing in a small group of people, and it's a venue where it's large enough we can social distance and wear masks when we're not performing. And so we're gonna still try to do that. I told her as long as, if states are still allowing travel, then we'll be there. But because it sounds like she's doing as much as she can to make it safe. So yeah, so that's something that's fun and different that we're looking forward to. So
This sounds like fun.
yeah.
Do a lip sync battle. part of that. That's pretty cool. Angela Whedon, are you going to do anything? Are you going to see your family?
Staying here. Wait a minute. I'll be here because of the travel ban. I'll just be out at my aunt's house. I think we're just gonna social distance, but this year I'm with the organization, HBCU Alliance. We're sponsoring a shelter. So that's something different. I'm gonna do this year, take some gift cards to a shelter because I really can't be with my family, drop some gift cards off, but pretty much I'll just be at home and hanging out, social distancing with my aunts. That's pretty much it.
Okay, Felicia, how about you? Oh, you said you're going to Dumas, right? What about you, Anthony?
Well, fortunately, the majority of my family lives in my house. So, so my daughter who lives in Texas just got here. So that's the only person that's had to do any traveling. But what we'll do is just kind of do some things here around the house. I've asked both of my daughters to kind of come up with a community service type of project for us to do as a family. So I think we're going to do that as well. I know one thing that my cousins and I do. We have a virtual meeting, and we've kind of, and this was even they live in different areas of the United States, and so we'll get.
You're frozen. There we go. You're frozen. Can you hear me? Okay, I think we'll go to our next person. Well, let's go to the Cannon, since they're not leaving the house and nobody can come in. So what do you have planned for your family? We still can't hear you.
Okay, yes. We wanted to be somewhere. We were supposed to have been in Hawaii this year, but we didn't get to go. But I think we're gonna do, our oldest daughter is always putting something together. She says she wants everyone to do, what is it, Zoom on Christmas. We didn't do gifts either because nobody's here, just the boys are here. So we sent out Christmas money this year. They wanted gifts, but I'm like, no, there are no small kids here, so mom and dad gonna sleep late.
Okay, I heard that.
Yes.
And who is this with this iPad up? Is this Erica driving?
Yeah, it's me. I'm driving.
Girl, you've been driving for like 10 hours. You've been driving for like
you know me. I'm always multitasking.
I was thinking the same thing. I was like, she is really driving.
I was like, who is that person that's traveling already?
Erica driving around in circles in the parking lot.
Hi, Chris.
I'm just now pulling off the highway, so I'm just now pulling up in the driveway. So as far as my Christmas, well, first let me say I enjoyed listening to everybody testimony, and it's been really, really good, especially hearing how y'all are surviving. And I appreciate y'all sharing y'all stories. Also, as far as me, all my family's in Arkansas. And so it's just me and my son and my son's 2 kids. So my son's living with me. He's been with me ever since quarantine. And so, but I'm so ready for him to go. so I need to have my place back to myself. so the good thing is I get to see my grandbabies. But other than that, I was like, oh my God, let me have a place back to myself. Where I'm normally working on holidays, and so he'll probably be with his fiance's family, and me, I'll be working. But I usually send gifts down to my parents' house. So what I did this year is I went to Amazon and have it delivered to my family. And this year, and they still fussing about that kind of stuff. So they prefer the gift cards compared to the gifts. As far as me doing anything, mainly it's for the grandbabies, putting up decorations, Santa Claus, and all that stuff. So they'll be over later on on Christmas Day to come get their gifts.
Okay.
And that's about it.
Alrighty. How about you, Cooley?
Hey, what's up, family?
Hey.
Hello, Cooley.
Well, me and my family, we're gonna get together, but we take Clorox shots before we do that. So we make sure we all right. Now I'll probably get with my brother and we get something to drink and watch some football. That's basically about it. What's up, birthday twin, Cannon?
Frat, I was just telling my wife, I said, that's my frat brother. We born on the same day.
That's right, that's right, that's right.
And when you just said that, I said, that sounds like me. Get bed, drink, watch some football.
That's all. I mean, there's not too much you could do as far as getting out or anything. So I just chill
Right.
with my brother and just, toss it up a little bit, have a little fun.
That's it. Ask the Lord to keep us, hold on to us a little bit longer.
Talk to me. Come on, preach.
Wendy, are you with us?
Huh?
Is Wendy with us?
Might have it on mute.
Okay, well, we have Chris Giles here on a little Zoom call now. So what are your plans for the holiday? And what, if you have any ideas for families to stay safe and have fun at the same time?
Well,
Yep.
well, I will be at work, which I am at now. I after work, just do a little Zoom, do some FaceTime with family members. And buy my beverages before on Christmas Eve, watch TV and drink and be merry. That's the only thing that I can do at this particular point. Even I went, we had some Epsilon Chi Frat to show up here in Texas this week. Even when we went out to the restaurant, it just didn't feel the same. We had to do the social distancing and it's, but I'd rather be safe than ill, so I just want everybody to change the mindset in regards to spreading the word of, this is not a game, this is for real. I've literally had 10 family members to pass away from COVID-19.
Oh.
Last one was in Cannon, and every last one of them, guess where they was at? East St. Louis, Illinois. So this is for real. And if you're feeling sick, go get checked. Stop trying to diagnose and remedy yourself. Go get checked. But I try to stay, the positive readings that I do keeps my spirits up. So, and I'm the only one in my immediate family that is here. Everybody else is back at home. So I do what I'm going to do. Like I said, get my beverages, get food, and watch TV. Yeah. Guys, I know we're running a little over. We kind of want to end it because we don't want to go over too far. Because I know individuals have time, things to do. And I personally, the chairman of the UAPB Kappa Kappa Psi Tau Beta Sigma Regional Alumni Association, do appreciate each and individual person that took out time to be a part of the the effects of COVID-19 part 2. Thank you to the Candace for sharing your story. I know Mr. Fuller had some other obligations, but still came on board, such as Mia as well. And I really want to say something to Mia because, believe it or not, the first one that we had, Mia mom died the day before our seminar. And I am so glad that she was willing to do part 2. And I met her a few years ago at the Honda Ballot of Bands in Atlanta. And we've always developed a bond since then. I'd like to thank you, Ashlyn, once again, also representing Tau Beta Sigma, for just providing us with your wisdom and sharing your thoughts and professionalism as well. Mr. Ward, it's always a pleasure speaking with having you on here on anything that we do, because I think I told you this last time, your calming voice soothes people. And when I've learned, when you have someone that has that calming voice with wisdom, that makes them feel calm. Thanks for everyone that came our time out of their busy schedule. And hopefully we'll keep this going. Maybe it could be something else that, is affecting us on a grander scale. And one thing that I've noticed that with this COVID-19, has affected us is not only the mental aspect of it, but also the financial aspect of it. And maybe hopefully we can go forward, maybe doing something on finances or something like that. But as long as we have this bond and this fellowship, and Frank know what I'm talking about, that 5 points of that star, if we keep doing what we're doing, that's what we're here to do for. All righty. Does anybody have any other questions or concerns or anything to say?
Well, Chris, just let me start by saying, thank you for, number one, putting this together. I think we all are a little bit more aware of its effects, although some of us, we work in the mental health facilities and we may have someone who has had it. But even today, I've learned just by listening to the canons, I'm understanding a little bit more about how it's affecting people. I was glad to see Brother Jeffrey on here, and he was looking and sounding really well. My wife kind of made that comment to me, and compared to the last time, so I can see where things are definitely going up in his favor, and so I congratulate you, and I'm proud of what you guys are doing with the Regional Alumni Association, and I look forward to future panel discussions, whether I'm on a panel or not. And I just want to say, keep up the good work.
Great.
Yeah.
Cool.
Thank you.
Anyone else?
I just want to say thank you again. This, like part 1, this is just a great experience. So it's really my pleasure to be here. Thank you for allowing me to be part of this event.
Wonderful.
It's been a pleasure for us as well. Thank you a lot, Chris, for telling hubby about it and setting us up. And I've enjoyed meeting everyone from afar. And everyone has said something today that we can take with us to help us in this journey, we call it, And shout out to Miss Felicia, who's in Houston. That's because that's where we are. Everything she said, our daughter is going through in New York because she's a teacher too. So we got to look out for our teachers too.
Absolutely.
Definitely. Thank you, Chris.
Oh, you're welcome. Absolutely. Felicia, anybody else got anything to say? Erica?
No, Chris, thanks for inviting me, reminding me about this. I be in and out. I'm not even going to tell a story, but I do take my precautions. I am a basketball coach, and so we do still have trainings. We're not having any games or anything, but we still have to keep them conditions. I do have a lot of guys on my team who are within the top 10 ranked for Texas. So I have to make sure that I keep them abroad with their skills. Like right now, that's where I'm getting ready to go to basketball trainings. But other than that, thanks. I carry this everywhere I go. My disinfectant, my hand sanitizer, like everywhere. So we just stay abroad, stay healthy, stay clean.
Absolutely. What about you, Erica?
And thanks to the moderator. She did a great job.
Thank you.
Yeah, Maureen.
Yes.
Thank you. I got over my little shyness.
You ain't shy. Stop telling the story. I like I said before, I really enjoyed everything. I think this is just my opinion. I think we should do something like this, like once a month, where everybody can get together and just talk about what's going on in their lives and stuff. Even just to decompress some things that might be going on. Thank Chris for putting it together along with Maureen and Angie and the Personal Development Committee. This was really good and really informative. Like I said, I'm usually busy all the time. I got several things going on, but just to sit back and listen and don't have to do anything and just absorb what everybody's saying, it was really good for me. And I learned quite a bit by listening to what you guys are doing. And like I worked in the health field for a while, but as far as I've been isolated since March. So I've been working from home since March, and they just informed us that we're working home throughout the first quarter. So I'm very careful about when I go out. I have my hand sanitizers, my disinfectants, and my son works for Amazon. I make him spray himself down every time he comes into the door. And we just found out at my job, luckily I'm not there in the office, but 2 people just tested positive for COVID. But if I would have been there, I probably would have been exposed. And so it's a good thing that I'm working from home. But I'm glad to hear about the process that the people who are survivors, so I can look for signs and symptoms, like from my son or from my grandchildren or from other family members. Per my parents, they think they had it back in February.
Me
The
too.
doctors in Pine Bluff told them they had the flu, but my mom said she never seen my dad so sick where he couldn't get out of bed, period. And that's not like my father at all. And he was there in bed for a week. And they said he had walking pneumonia. But at that time, that early, it was not known as, we didn't know it as COVID back in that time. And a lot of people know Pine Bluff runs behind all others. So when it finally got to them, then they believe they had it back in February. So listening to everybody's signs and symptoms, I believe they also had it too. And they just, they were just lucky enough to get through it.
Absolutely. All righty. And I would like to personally thank Maureen for taking a challenge that I gave to her and asking her to be the moderator. Because unfortunately I was scheduled to work today, but I believe she did a great job. Well, I don't say believe, I know she did a great job in the fluid conversation that was going on. And I also tell everyone that I believe I had it as well back in February. I was in that crowd that went to Mardi Gras, came back from Mardi Gras, and I was sick for 2 weeks. And I had the symptoms, no taste. I was so weak I couldn't get out of bed. At one point, I know my kidneys was getting ready to shut down because I couldn't urinate for almost a day. So I know that I had it, but back then they didn't have testing for it. Once again, thank you guys for taking out the time. Thanks for the fellowship and knowledge. And we're going to continue this platform. We're going to maybe try to do it once a quarter or once a month, or however we want to do it. For those individuals that are not part of the RAA and don't belong to another alumni association, be more than happy to join, because even though it says UAPB Regional Alumni Association, no matter what chapter you belong to, you can be a part. We have individuals all the way in Arizona, like Wendy. We have individuals that's on the East Coast, such as Alicia Rowden. We just want to be an organization that is for, I don't want to say the seniors, but for the ones that are not in band or not in undergrad anymore, and still have that fellowship and to spread that knowledge to everyone. All righty, we're going to end the seminar for the COVID. Oh, Angie, go ahead.
I got one more thing to say. I just want to say thank you to the Cannons and thank you so much. And for Jeffrey, I think his name was Jeffrey, he's not on here, but talking about the residual lasting effects. I work in foster care. I'm a foster care supervisor, and I have 2 workers that I supervise have had COVID. One currently has it and one is recovering from it. And when you talked about the memory loss, I was actually talking to her yesterday and asking her to do something. She said, I don't remember you told me that. But I'm like, I just told you. So being mindful, now I will be mindful about the residual effects, because I didn't even think about that, because like you said, you don't hear that on the news, anybody talking about that. So thank you so much. And I'll be more mindful when I hear her talk about different things that she's going through, like, oh, it might be related to the COVID residual effects. So thank you so much for that.
Absolutely. Absolutely. All righty. Anyone else before we end the Zoom seminar?
I say something. So when you all get tired of going to find that Lysol and the microban and the hand sanitizer, get at me, because my partner is FDA approved for the hand sanitizer. And when he cuts it, it's up to 75%. And then the disinfectant that they have approved, we're going through the process right now to finish. We're in the second phase of being EPA approved also, which it does include MAQUAT, but if you look it up, MAQQAT, it is what they're using currently now for a disinfectant that's coming out for COVID-19.
Wonderful. Thank you for that information. Absolutely. All righty. Once again, thanks for all the attendees, thank you for the moderator and also the panelists. Once again, this was a successful seminar, and you guys enjoy the rest of your Saturday, okay?
You too.
Have a good day.
Bye.
Yeah.
Bye, B.
Bye, sorors and friends.
Bye-bye.
I have a good Christmas and stay safe.
Absolutely.